Despite better diagnosis and treatment for tuberculosis, many still suffer and die from it. This is partly due to TB's growing resistance to medicine. But a team of Korean and French researchers may be able to help fix that problem. Kim Hyesung sheds light on their findings.
Tuberculosis is a disease that's affected humans since prehistoric times, but despite modern medicine, it remains one of the top 10 causes of death worldwide. According to the World Health Organization, in 2015, over 10 million people were infected with TB, and 1 in 10 died from it due to a lack of vaccines in developing countries and because of drug-resistant strains of the disease. Tuberculosis is treatable and curable, but the standard antibiotics won't work if a patient develops a drug-resistant strain. However, a team of Korean and French researchers have developed a new compound that could reverse that drug resistance. When TB becomes drug-resistant, it deactivates the main ingredient in the cure, a compound called ethionamide. The team's new molecule, called small molecule aborting resistance, or SMART420, reactivates ethionamide so the drug will work again. Tested in mice, the SMART420 showed significantly reduced bacterial load in their lungs 3 weeks after infection compared to the controls.
It's significant because it can at the same time revert the resistance, so we can use this antibiotic again, but at the same time, the same antibiotic is more efficient. It boosts the effect of this antibiotic, so the dose you need is lower, there is less side effects, and then you increase the compliance of the patient to the treatment.
Patient compliance is critical because many stop taking the standard 4 tuberculosis drugs before the required 6-month period ends. They start to feel a little better and go off the drugs without consulting their doctor, which is one reason some end up developing drug resistance. The researchers have worked on tuberculosis treatment for over a decade and say their next goal is to start clinical trials on humans and ultimately create SMART420 medicines that will help eradicate tuberculosis. Kim Hyesung, Arirang News.